Hi friends. Welcome to our channel Global Health Helpline. Today we will learn about a homeopathic medicine Alumina from the book, Lectures on Homeopathic Meteria Medica by James Tyler Kent. It is the second part of this remedy. Please see the first part of the video. The link is given in the description box. Please subscribe our channel to be connected with us. Let's begin. Skin. When we come to the skin, we find that it takes on a similar state of affairs. The patient is subject to all sorts of eruptions. The skin withers, becomes dry, and is subject to eruptions, thickening, indurations, ulcerations, cracking, and bleeding. The eruptions itch worse in the warmth of the bed. The skin itches, even when there is no eruption, when becoming warm in bed, so that he scratches until the skin bleeds. This presents an idea as to eruptions that you will have to consider. A patient comes to you covered with crusts, and he says, "When I get warm at night I have to scratch, and I scratch until the skin bleeds." Now in Alumina it is very important to find out whether these crusts were produced by the scratching or whether the eruption came out as an itching eruption. For in Alumina in the beginning there is no eruption, but he scratches until the skin is off and then come the crusts. You must here prescribe not for the eruption, but for the itching of the skin without eruption. Now in Mesoreum, Arsenicum, Dolichos and Alumina the skin itches and he scratches until it bleeds, and then he gets relief. Of course after this there is an apparent eruption because crusts form. As soon as the healing begins the itching begins, and he is only relieved when the skin is raw. With the bleeding moisture of the skin there is relief of the itching. Now some of the books do not make the distinction between itching without eruption and itching with eruption, and hence mostly all young doctors get to thinking that itching of the skin must always be associated with eruption. And make a mistake in figuring out what kind of an eruption it is. The skin thickens and indurates and ulcerates, and there are indurations under the ulcers. There is a very sluggish condition of both mucous membrane and skin with a tendency to induration. Thickening of the mucous membrane will be found anywhere. After the thickening come little ulcerations, and in the course of time indurations are formed at the base of the ulcers. The same thing is true of the skin. Dryness and burning through everything and may be said of all the mucous membranes and the skin in general. Chronic granular lids. If we turn the eyelids down we will see that the mucous membrane is thickened. Sometimes this thickening or hypertrophy causes a turning out of the lids like ectropion. The eyelashes fall out, that is in keeping with the general state. The hairs all over the body fall out. Parts become entirely denuded of hair. The hair of the scalp falls out extensively. All sorts of sounds in the ears, buzzing, etc., and derangement of hearing, purulent Otorrhœa. Point of nose cracked, is in keeping with the remedy. Induration here and there so that it favors lupus and epithelioma in one who is subject to these swellings and eruptions. Alumina and Alumin, like ARs, Lech, Sulf, and Conium, are medicines that relate to these troubles. Some of these have made brilliant cures where there is infiltration. Upon the skin of the face and other parts of the body there is crawling itching, especially when getting warm. Sensation of tension. Peculiar sensation about the face and other parts not covered by clothing, a sensation of dried white of egg on the face, of dried blood or cobweb on the face. If you have ever been going through a place where there are cobwebs and a little cobweb has strung across your face, you will know what a peculiar sensation of crawling it produces, and you cannot leave it alone until it is removed. That sensation particularly belongs to Alumina, borax, bar, c. Little crawlings and creepings in the skin. Itching of the face. These symptoms are so irritating that the patient will sit and rub his face all the time. You will think that he is nervous. He has the appearance of being nervous as he sits rubbing the back of his hands. It is well to find out whether he does this because he cannot keep his hands still or because of the itching. Because of this itching sensation in the face he carries the hand to the face as though to brush away something. Throat. Perhaps I have not said as much as should be said about the throat. Ulcers in the fauces, spongy, secreting a yellowish-brown, badly smelling pus. It may be said that the patient is often a victim of chronic sore throat. There is this about Alumina, it has a special tendency to localize itself upon mucous membranes. You will find in an Alumina subject bleeding from all mucous membranes. He has catarrh of the nose and red eyes, and his nose becomes stuffed up and he has many acute colds. Very severe throat trouble. Discharges from all of the orifices. It is not a medicine that would be selected for a cold settling in the throat, not a remedy for acute sore throat, but it is a deep-acting antisoric, an act for months. Its greatest usefulness is as a remedy for taking cold. In this respect it is like sil, graph, and sulfur. It affects tissue changes, and it does this slowly, for it is a slow-acting medicine. While the patient himself with these deep-seated psoric affections feels better generally after the rheum. It will be months before his symptoms go away. He may say, I feel better, but my symptoms all appear to be here. I can eat better and sleep better. Then it would be unwise to change the remedy. You need not expect to get immediate relief of the catarrhs and pains in the back and other symptoms for which you gave this remedy. You may be satisfied if you get the results after many weeks. You will find the same thing in the paralytic weakness produced by plumbum. There is a new drug that is coming into use, the proving of which is very full and rich, and it is analogous to the symptoms of this remedy. It is curare. Curare. I wish we had a finer proving of it, but it is rich with a great many things similar to Alumina and plumbum, and especially in the weakness of the hands and fingers of pianists. An old player will say that after she has been playing for some time her fingers slow down. The weakness seems to be in the extensors. Lack of ability to lift the fingers, the lifting motion is lost. Curare to a great extent overcomes that, causes quickness to that lifting power of the fingers. But this remedy also runs through in general ways such paretic conditions, while curare is especially related to a paralytic condition of the extensors more than the flexors. The paralysis in Alumina is of both flexors and extensors. Alumina. This medicine is one of the few that have been found to be aggravated from starch, especially the starch of potatoes. Aggravation from eating potatoes. It has indigestion, diarrhea, great flatulence, aggravation of the cough from eating potatoes. It has also aggravation from salt, wine, vinegar, pepper, and from spirituous drinks. Alumina is a spinal remedy, and aggravation from spirituous drinks is in keeping with some other spinal remedies. You find it in zinkum. The zinkum patient cannot drink wine, for all of his complaints are aggravated by it. This medicine is so sensitive and so easily overcome by a small amount of liquor that he is obliged to abandon it. He is not only intoxicated by it, but it aggravates his complaints. Stomach and digestion. Now the digestion has practically given out in this medicine. He is subject to catarrh of the stomach, to ulceration of the stomach, to indigestion from the simplest food. Sour and bitter eructations. Vomiting of food, mucus or bile. Nausea, vertigo, heartburn, much flatulence. Vomits mucus and water. Stomach is distended with gas. The liver is full of suffering. Both hypochondria are full of misery, but especially the right. When going over alumina, I called attention especially to its antidotal relation to lead. This remedy also will overcome the poisonous effects of lead and sensitiveness to lead. Colic and paralytic weakness in lead workers, painters and artists, and in those who are so sensitive to lead that from mucin hair wash containing lead they are paralyzed. Not many years ago the acetate of lead was commonly used by women for leucorrhea, but it was found that so many were sensitive to it that it was abandoned. Alumina is the most prominent antidote to the affections which have come about through that site of state. Fissures. There is so much under stool and rectum that belongs to the general state that there is scarcely anything left to be presented except some important particulars. As you might suppose, this remedy has fissures. You would naturally expect these when you consider what kind of mucous membranes and tissues this patient manufactures. He suffers greatly from constipation, he does much straining, the mucous membrane is thickened and swollen, and hence we have a fissure. When you see a remedy manufacturing and producing such a state upon the economy, growing that kind of mucous membrane that would favor fissures, you do not have to wait until you have cured a fissure with that remedy to find out if it will suit the case. You do not have to resort to the repertory to see what this remedy has done in fissure. From your general knowledge of the medicine, you will see that it ought to cure the patient, as it produces such a condition of the mucous membrane and skin as would be naturally found in one who has a fissure. The skin indurates and ulcerates and becomes clumsy and unhealthy, and constipation is produced, and so, after studying the remedy in that way, you are not surprised if it cures a fissure. You can also think over what other medicines have this state of the economy and see what other remedies you expect to cure a fissure with. If you look into the nature of nitric acid, causticum and graphites, you will see why they have had a wonderful record for curing fissure. That is the way to study your Meteria Medica. See what it does to the man himself, to his organs and tissues. Bladder. Frequent micturition. Urine voided while straining at stool, or cannot pass urine without such straining. That is a high-grade symptom, it is a peculiar symptom, and may be called a particular of first grade. He must strain at stool in order to empty the contents of the bladder. Urine smarting, corroding. Feeling of weakness in the bladder and genitals. Swelling and discharge of light yellow pus from urethra. Quote, burning with discharge of urine. Male. The symptoms of the male sexual organs are characterized by weakness, impotency and nightly emissions, suitable when the sexual organs are worn out from abuse or overuse. There is fullness and enlargement of the prostate gland and various disturbances of the prostrate, with sensation of fullness in the perineum. Unpleasant sensations and distress in the region of the prostate gland after coition. Complaints at the time of, or after ejaculation, or after an emission. The sexual desire is diminished and sometimes entirely lost. Paralytic weakness or paresis of the sexual organs, a state that is in keeping with the whole remedy. Discharge of prostatic fluid during difficult stool. Painful erections at night. Female. The female has a great deal of trouble that can be cured with this remedy, but her troubles are mostly catarrhal. An instance of this is the leucorrhea, copious, acrid or excoriating, yellow leucorrhea so copious that it runs down the thighs, making the parts red and inflamed. Ulceration about the os. The mucous membranes are weak and patulous and ulcerate easily. All the parts are in a state of weakness. There is dragging down from the relaxed condition of the ligaments. Sensation of weight, the pelvic viscera feel heavy. The discharge, stringy, looking like white of egg, copious and acrid, transparent mucus. Leucorrhea, corroding, profuse, running down to heels. It is more noticeable in the daytime, because these complaints are generally worse when walking or when standing, which is not really an important sign. MPTOM, but a common condition. After menstruation it takes the woman nearly until the next period to get straightened up. All her muscles are weak, there seems to be no tonicity about her. It is highly suitable to women drawing near the end of menstruation, about 40 years of age. The menstrual period prostrates, the flow is scanty, yet prostrating, the sufferings are terrible and the patient is miserable at the menstrual period. After menses, exhausted in body and mind, is a strong feature of Alumina. It is a suitable remedy again when the woman has a gonorrhea which has been prolonged by palliation. She has been made comfortable by partly suitable remedies, but it seems that no remedy has been quite deep enough to root out the trouble, for it keeps coming back. In a discharge that keeps returning, better for a little while on pulsatilla, and on this and that and the other thing, and even on thuja, given more especially because it is gonorrhea than because she is a sick woman. The patient is tired and worn out, and when you come to look at the whole patient and you see the paretic condition, the continued return of the discharge that has been palliated by remedies, think of this medicine in both the male and female. The discharge is a painless one in the male. The gonorrheal discharge has lasted a long time, going and coming, until now there is left but a few drops and it is painless. The remedy has cured many of these old cases. Threatening chronic catarrh. The mucous membrane everywhere is in a congested state and is weak. A pregnant woman has some trouble as well. A woman, who is not naturally a sufferer from constipation, when pregnant becomes constipated, with all the characterizing features of Alumina, i.e., the inactivity of the rectum, no expulsive force, she must use the abdominal muscles, must strain a long time. Infant. Again, the infant has a similar kind of straining. You will see the newborn infant, or the infant on few months old, that will need Alumina. It is a very common medicine for constipation in infants when you can find nothing else, the child will strain and make every effort to press the stool out, and upon examining the stool it is found to be soft, and should have been expelled easily. It has hoarseness and loss of voice and paralytic weakness of the larynx. That is not strange, it is only in keeping with the general state, the broken down constitution. He has a weak voice and, if a singer, he is capable of singing only a little while, only capable of slight exertion. Everything is a burden. A paralytic condition of the vocal cords, which steadily increases to loss of voice. Cough and chest. The most striking things we come to now are the cough and chest troubles. There is expectoration in some of the coughs, but the cough is usually a constant, dry, hacking cough, one of those troublesome lingering coughs that has existed for years. It competes with Met.in its character of the dry, hacking cough, especially associated with weakness, but Met has the cough in the daytime, which is not so in Alumina. The Alumina cough is in the morning. Here is a symptom that about covers the Alumina cow. Cough soon after waking in the morning. Every morning, a long attack of dry cough. The cough is hard, a continued dry hacking, and she coughs until she loses her breath and vomits, and loses the urine. This symptom commonly occurs in the woman. Dry, hacking cough with frequent sneezing. Quote, it says in the text from elongated uvula, but it should read from sensation of elongated uvula. It is a sensation as if there were something tickling the throat, a tickling as if the uvula were hanging down a long distance, and he will tell you that his palate must be too long. Another expression which is the same thing is cough from sensation as of loose skin hanging in throat. Sometimes those who do not know about the palate will talk of something loose in the throat, while those who know they have an uvula will generally call it the palate. But it is the same idea. Tickling in the larynx, too. Singers. This is always quoted in singers. We would think of Alumina when singers break down in the voice from paralysis or from overwork of the voice. The voice lets down and becomes feeble, and, when taking cold, there starts up a peculiar kind of tickling. Alumina is very useful in these cases. Met was the remedy used by the earlier homeopaths for singers and talkers with much trembling and letting down of the voice before the value of Alumina was known in such conditions. Let me tell you something here about RHUs, as I may not think of it again. Many old singers, after taking cold, have a weakness left in the voice, which they notice on beginning to sing. On beginning to sing the voice is weak and husky, but after using it a little while it improves. Give rest to all these patients, prima donnas, lawyers, preachers, etc. They must warm up the voice and then they are all right, but they say, if I go back into the green room and wait a little while, when I commence to sing again I am worse than ever. The voice is better if they stay in a very hot room and keep it in use. This fits into the general state of RHUs. Hoarseness. There is a kind of hoarseness that you may discover to be a little different from the paralytic hoarseness of Alumina and Met. This hoarseness of which I speak belongs to this same class of people. On first beginning to use the voice it seems that they must get rid of some mucus by clearing the throat until the voice can get to work. The vocal cords on beginning to work are covered with mucus and on getting rid of it they can do very good work, so long as they keep at it. That is phosphorus. In such cases the use of the voice becomes painful. The vocal cords are painful after motion and the larynx is painful to touch. Sometimes this is so marked that it is like stabbing with a knife on trying to use the voice. So we must individualize hoarseness very extensively. Homeopathy is a matter of discrimination. Soreness of the chest which is much increased by talking. There is weakness of the muscular power of the chest. The lungs seem weak and the chest has a sensation of weakness in it. Jar increases the misery of the chest. Back and limbs. The next most striking features will be in connection with the back and limbs, and I have spoken of these in general way. Burning in the spine, much pain in the back. Burning and stitching pains in the back. He expresses it as follows. Pain in the back, as if a hot iron was thrust through lower vertebrae. In myelitis this medicine does wonderful work when there is a considerable amount of spasmodic condition of the back as well, showing that the membranes are involved. Another thing that belongs to this remedy that is a well-known state in myelitis is the hoop sensation of bandages here and there about the limbs and body is a common symptom. A sensation of a tight cord around the body characteristic of the most marked state of irritation in myelitis. Irritation of the spinal cord with sensitive places. Burning places as if a hot iron were forced into the spine. Pain along the cord, rending, tearing pains in the cord with paralytic weakness, increasing paralysis and complete paralysis, paralysis of one side of the body. Pain in sole of foot on stepping, as though it were too soft and swollen. Quote, numbness of heel when stepping. Trembling of knees, this is a mere matter of the general weakness. Limbs go to sleep when sitting. Whenever the limb is pressed against anything it will go to sleep. Feeble circulation, feeble conductivity, feeble nerve action, everything is slowed down. Arms and legs feel heavy. Pains in limbs as if bones were squeezed narrower, with pressure in the joints. Now I will read some of the nerve symptoms which will corroborate some of the things we have gone over. Want of bodily irritability. Great exhaustion of strength, especially after walking in open air. One-sided paralysis, especially of the extensors. Rheumatic and traumatic paralysis in gouty patients. Quote, gouty patients with nodules in the joints, old broken down constitutions with paretic exhaustion. Excited condition of mind. He must make slow motions, he cannot hurry. Involuntary motions. Sleep and dreams. There are all sorts of dreams and disturbances in sleep, so that the sleep may be quite disturbed and restless. Unrefreshing sleep, waking up with palpitation of the heart. Many dreams and frequent awaking, starts in a fright, muttering or crying. During sleep cervical muscles drew head backward. This is in cases of paralytic weakness. Has to wake up as the muscles of the back of the neck pulsa. Jerks in the back of the neck during sleep. Running through the remedy very often, there is a great lack of animal heat, coldness, and yet the patient wants to be in the open air. Must be well clothed open and kept warm, but wants to be in the open air. The patient takes cold continually from every change in draft. Sometimes the patient will go to bed as cold as a frog, and when warm in bed is so disturbed by itching and the warmth of the bed that there is no comfort. These are two extremes coming together. The circulation is so feeble over the extremities and backs of the hands that in cold weather the hands are constantly cold and covered with cracks and fissures that bleed. Skin. The skin along the shin bone is rough, ragged and itching. It has been said that dry weather and dry, cold weather increase the complaints of alumina, and that wet weather sometimes ameliorates. The febrile condition of this remedy is not at all marked. There is not much chill and not much fever, but the passive, slow, sluggish chronic elements and chronic symptoms are the ones that prevail most markedly. In weak, broken down cases there are some night sweats and sweating towards morning. Slight chill in morning. Chill with thirst. A striking feature of the remedy is the chronic dryness of the skin. Sweat is rare and scant. This is not especially suitable for this copious, exhaustive sweats. It is the very opposite of Leucorrhœa, which sweats copiously, but this remedy, with spinal and paralytic affections, is tired out from exertion, very exhausted, but does not sweat. Pile on the covers to make him sweat if you will, but he only gets hot and itching and does not sweat. Scanty sweat. Entire inability to sweat. Chronic dryness of skin with fissures. The skin becomes worn and ragged and fissured from its dryness. Great dryness of the thick skin over the back of the hands, and in cold weather the hands become cold and discolored.